I'm here with MU Healthcare trauma surgeon Dr. Jeffrey Kokenauer and hand surgeon Dr. Daniel London, who, as part of a level 1 trauma center, have seen plenty of fireworks injuries. Dr. Kokenauer, what are some of the most common firework injuries that you see every year?
The hands are probably more often talked about, but we've seen injuries from head to toe, burns to the face, eye injury, devastating injuries, in fact, to the face and skull from mortar shells, burns all across the body, certainly areas that are not protected by clothing, potentially more at risk.
There are differing levels of burns that can happen when you have a firework injury, which means different levels of care. What do people need to know?
For the more minor injuries, we would just advise to wash the area with gentle soap and water and keep a close eye on it. For the more extensive burns, that's something that would advise to get looked at by a physician at MU Healthcare. Sometimes requires specialized dressings, or in more rare instances would require an operation to remove the injured skin and sometimes even perform skin grafting.
Dr. London, hand injuries are some of the most common when using fireworks. Why are hand injuries so complex?
There's a whole host of different structures within the hand, whether we're talking about nerves, arteries, veins, tendons, ligaments, and then the bones, as well as the skin. And all of those can be involved in these injuries, creating multiple structures that need to be treated, often simultaneously, which can complicate that treatment and then the ultimate recovery as well.
If surgery is needed, what can patients expect from a level 1 trauma center like MU Healthcare?
So MU Healthcare is the perfect place if you're unfortunate enough to have one of these injuries to be treated. And that's because we are a level 1 trauma center. And so we have all the resources available 24 hours a day, 7 days a week. So that includes acute care surgeons, like my colleague, Dr. Kokenauer, as well as orthopedic surgeons, hand specialists, but even just beyond the surgeons themselves, it's the ER staff, it's the operating room assistants that we have, and the care afterwards is fantastic and comprehensive and integrated, so that, if you have one of these more devastating hand injuries and you need a lot of hand therapy afterwards to help recover your function, we have hand therapists that are fantastic, they're certified, and so all those resources that MU Healthcare has are kind of focused on trying to get you as the patient as good of an outcome as possible.
Dr. Kokenauer, Dr. London, thank you so much for helping keep our community safe. For University of Missouri Healthcare, I'm Meg Judy.